I want to welcome Brian Morris, Operations Superintendent with the Ottawa Paramedic Service, to the program because, Brian, this is Emergency Medical Services Week.
That's correct, it is.
What happens during this week?
During the week, it's celebrated nationally as just promoting what paramedics do and how our profession has evolved over the last number of years.
And evolution has been big, certainly in recent decades, wouldn't you say?
Absolutely, absolutely. I've been been paramedic 20 years now, and I've seen a lot of change in my career.
What's the major change that you've seen since you've been in so long?
The major change for what I've observed is just the increase in our scope of practice, what we're doing to improve our patients' outcomes and survivability and decrease the mortality rates.
Exactly, because you're doing more on scene, on site of, let's say, an accident or an emergency situation than you ever have before.
Absolutely, absolutely. We're doing things in people's homes and at the sites of wherever their emergency is, whether it be an accident, a medical case. We're doing more of the things that used to be done only in the ER. We're doing now at the scene, which is increasing their...
Which is what we're going to demonstrate today, actually,
absolutely,
right?
Yes.
What is this called that we're going to see here?
What this device is called the EZ-IO, and what it is, it's called an interosseous needle, and it is used as rapid access to the patient's vascular system. Mm-hmm. We use it for our adult or pediatric patients, and what it does is it's quick access to their vascular system if we need to give them fluid or medication. Right. Traditionally, we use peripheral IVs, but in an emergency situation when the patients are critical and time is really a factor, and peripheral IVs are difficult, we use this. And what it basically does is it drills a needle into the bone, into your tibia, so the large bone in the anterior surface of your leg.
Gotcha.
It drills it in there, and then we're able to attach an IV line to that and give fluid and medication. And any medication or fluid that's given IV can be given through the IO, they call it. Right. And you've got an example of this right here. This is just a plastic, an artificial bone, and we use that as a method of practicing to do our IO technique. Okay.
Can you show us how it works?
Absolutely. So what we have is we have the driver here that has the IO interosseous needle on it. What we do is remove that, the safety tip.
This is actually going into the bone.
Exactly, exactly. So and this is basically like a drill. If you've ever done drywall work or anything, that's pretty much all it is. Now, I just have to tell people too that it's only used in critical situations. So if you have a minor injury or you're just not feeling well, we're not going to come and show up and do this.
No, this is in critical situations where time is of the essence.
Absolutely. Right? So what happens is the anterior aspect of the leg, there's a flat surface on the tibia.
Gotcha.
And we do that, and we landmark where it's going to go. Mm-hmm. And then basically it's just drilled in.
So you puncture the skin.
Drills in like that. It's as simple as that. It's as simple as that. We pull the driver off.
Okay.
And then what happens is that's removed.
So you've got a gateway into the system now.
Now we have vascular access. We set that aside. We have vascular access for the patient. We remove this. Excuse me for a second.
Right.
It just
goes on top of that.
Goes on top.
All right.
Okay. That gets secured down. Right. And then what happens is you have access to the IV now. This gets screwed on.
Okay, that goes in.
Sorry about that.
I see.
There we go.
Okay, so that screws in.
Sorry about that.
And then you can attach whatever sort of medication or what have you.
IV line, exactly. So this is flushed like that. This is taken off, and then an IV line is attached. So it's that quick to get access to the patient's vascular system.
Right. Why is this so much quicker and critical than an IV into the arm, let's say?
Well, IVs, it depends. When people have, say, cardiac arrest, their heart stops pumping, so the veins tend to flatten out a bit. Right. Sometimes they're hard to get access to those veins. You can use larger ones in the emergency setting, in the emergency room. They'll use central lines, subclavian lines, femoral lines, things like that. We're not able to do that kind of thing. That's quite a different ballgame altogether. Yeah. But this is very simple. It's very quick. And when you're going to have difficulty getting those IVs, this is something you will get. Yeah. As you can see, it's very quick to get access. That patient would be receiving medication and fluid as we speak within seconds.
This is unbelievable. It's actually a reworking of a procedure that was done early in like 30s and 40s, right?
Absolutely. I think the first case was somewhere around mid-30s where they used the bone.
Then they cut it out.
They kind of, it fell out of favor in the 50s with the advent of the plastic catheter that all the hospitals use and the paramedics use now as well. Then it reemerged in the 80s as a very good method of getting quick vascular access. Yeah. And now it is actually promoted that in cardiac arrest and extreme burns, shock cases, things like that, that we use that.
Incredible stuff. How can we find out more about Emergency Services Week and all that sort of thing?
Actually, the City of Ottawa's website, ottawa.ca, and check the paramedic link on that, as well as Googling, because it is national and it is international as well. The US does it as well. So there's lots of good stuff on Google, and it's worth checking out.
Brian, we got to run, but thanks for your time. And listen, I just want to say thanks for all you and your fellow paramedics do for us. We really appreciate it.
Oh, thank you. Much appreciated.